Aging spares no organ, just like the heart, brain, and bones. Your penis also needs careful care, especially when you turn 60. In today's video, you will learn essential care tips to protect your penis. In particular, you need to know a tip that very few people know, but directly affects the most painful and uncomfortable condition of the penis. This condition also affects your sleep and physical health. Regular sexual activity. Stay sexually active even if you don't have sex often. Many people have silently accepted the idea that sexual function declines with age and that there's nothing they can do about it. But here's the thing, not only is that belief wrong, it may actually be causing that decline to happen sooner. Your penis, like your muscles, your heart, or your brain, needs exercise to stay healthy. When your penis is inactive for long periods of time, blood flow decreases, elasticity weakens, and the tissue can begin to shrink. This isn't an exaggerated alarm, but a physiological fact. Disuse atrophy is much more common than men realize. The good news is that it's completely preventable. Sexual activity, including masturbation, is not just pleasurable. It is also vital to the body. It keeps the blood flowing, oxygenating the tissues, and maintaining their function. Think of it like stretching regularly to avoid stiffness. A long-term study in Finland found that men who had sex less than once a week were twice as likely to have erectile dysfunction over a 5-year period as those who had sex at least once a week. Sex goes beyond the physical benefits. It touches on a deeper level, a man's dignity and identity. For many men, sexual vitality is tied to self-image. When that fades, so does self-confidence. But by maintaining sexual activity in a way that works for you, you not only preserve function, but also maintain self-esteem. The key is not to return to the man you were at 25, but to stay connected to who you are now, a mature, experienced, and valuable man. I have seen many men in their 70s take back control of their sexual health by starting with this small step. And from there, many other aspects of their health and life improve. Clean properly. There is one important thing that many men often overlook until it is too late to realize: proper penis hygiene. The second way to care for your penis is to practice proper hygiene. It sounds simple, but you'd be surprised how many infections, irritations, and even serious illnesses I see in my office are caused by men who have never been taught how to care for their penis properly. Brazil, for example, has one of the highest rates of penile cancer, and poor hygiene is the leading cause. This risk doesn't go away with age, it increases. The point is to understand that the penis and the surrounding area need regular, gentle care. This solution is very simple and takes less than a minute. Wash your penis daily with warm water and a mild, unscented soap. The Australian Health Service recommends patting the genital area and foreskin dry after washing and avoiding the use of harsh soaps that can irritate sensitive skin. If you are uncircumcised, gently pull back the foreskin to clean underneath. Daily hygiene helps prevent the buildup of smegma, a mixture of dead skin cells and oil, which can cause odor, infection, and inflammation. Replace tight-fitting synthetic underwear with breathable cotton underwear and use a clean towel every time. Speaking of safe sex, let's talk about it. Using condoms and water-based lubricants reduces the risk of sexually transmitted infections, STIs, and protects the delicate tissues of the penis. The Mayo Clinic recommends getting vaccinated against hepatitis B and human papillomavirus, limiting your number of sexual partners and choosing your partners wisely, and practicing safe sex. Remember, infections like herpes or human papillomavirus can have long-term consequences, including cancer risk. If you have multiple sexual partners, get regular STI screenings. It's not about shame, it's about responsibility. Another simple habit is to do a monthly self-exam. Take a few minutes to look and feel your penis and testicles for any lumps, sores, or unusual changes. Catching abnormalities early can save your life. If you notice redness, persistent sores, discharge, or lumps, see your doctor right away. Many serious conditions, including penile cancer, are treatable if caught early. And avoid using harsh chemicals or perfumes on your penis. Anything that gets on your elbows or hair can cause irritation. If necessary, use a neutral, glycerin-free lubricant. After washing, dry thoroughly. Moisture can encourage yeast growth. Good hygiene isn't glamorous, but it's one of the most powerful things you can do for your sexual health. Don't let the penis get too hot. Few people know that the silent enemy of men's physiological health is temperature. The penis and testicles are designed to function best at a temperature lower than the body temperature of about 34 degrees C. Just an increase of 1 to 2 degrees can disrupt spermatogenesis, reduce testosterone, and affect libido, erectile ability, and sperm vitality. It is worth mentioning that many daily habits accidentally cause the genital area to heat up for hours without men knowing. The most obvious example is when working at home. Some people sit seriously at their desks, but many people comfortably place their laptops on their laps. Research from New York University has shown that after just 1 hour of placing a laptop on your lap, the temperature of the groin area will increase abnormally, directly affecting the ability to produce sperm. And if you repeat this habit for 2 hours a day, after a year, your reproductive organs will be heated for more than 700 hours. That is, continuously for nearly a month. Not only laptops are the culprits, but there are also many other habits that silently increase the temperature of the genital area. For example, the habit of taking 2 hot baths, sitting for a long time in a hot tub or sauna, which seems relaxing but causes the testicles to heat up quickly. Even in winter, sitting too long on a heated seat in a car is like cooking the genital area without you knowing it. In addition, a sedentary lifestyle, sitting for hours at a desk or in front of the TV, not only makes blood circulation difficult, but also causes heat to accumulate in the groin area, creating double pressure, both heat and lack of oxygen, all of which are directly harmful to men's physiological health. Sleep without underwear. Many men believe that underwear is an inseparable item, even when sleeping. But the truth is that taking off your underwear at night can have many surprising benefits for your prostate and overall male health. It's not just a strange habit, but is increasingly being mentioned by sleep experts, dermatologists, and even urologists as a small but effective trick. Biologically, the male reproductive system is designed to function at a slightly cooler temperature than the body. Normal scrotal temperature should be about 2.5 to 3 degrees Celsius lower than body temperature, and sperm production is optimal at around 34 degrees Celsius. It's no coincidence that the testicles are located outside the body and have their own vascular cooling system. Anything that increases the heat that builds up in this area over time, from tight underwear to non-breathable materials, can disrupt the body's natural microclimate. A large study in the journal Human Reproduction found that men who regularly wear loose-fitting underwear like boxers have higher sperm concentrations and counts than those who wear tight underwear. While the goal after 60 is no longer about fertility, the principle of staying cool and dry still has physiological and comfort value, especially at night when the body repairs itself. Not only that, sleep yours also benefits. Skin temperature is also directly related to sleep quality. When the skin is not stuffy, the nervous system will receive a signal indicating favorable sleep conditions, helping you fall asleep quickly and wake up less often in the middle of the night. On the contrary, heat accumulated under tight fabric makes it difficult for the body to dissipate heat, easily causing restlessness and insomnia. And good sleep not only helps the body recover, but also helps improve uncomfortable symptoms of the prostate, especially nocturia. The next benefit is hygiene and prevention of skin diseases in the groin area. Moisture, high humidity, and constant friction are three factors that promote fungus and dermatitis in the groin area. Many men over 60 suffer from itching, redness, and intertrigo for no apparent reason. The habit of sleeping without underwear is a natural way to prevent the formation of this moist environment. A well-ventilated groin area will be less irritated and will also feel much more comfortable and pleasant when you wake up the next morning. It sounds simple, but there are a few things to keep in mind to get the most benefit. First, make sure your bedroom is cool and comfortable, as gently adjusting your skin temperature to a comfortable level will help you fall asleep faster and sleep more deeply. Make sure your bedroom is cool and comfortable, ideally between 65 and 68 degrees Fahrenheit, about 18 and 20 degrees Celsius. If you're not ready to sleep completely untethered, switch to loose pajamas or breathable shorts for a week or two to get your body used to it. Keep your groin area clean and dry before bed, and dry thoroughly after your evening shower. Use cotton or linen sheets and blankets to increase ventilation and avoid materials that are too stuffy. If you sweat at night, you can add a thin layer of towel to absorb moisture. When sharing a room with a partner or with young children, you can use loose-fitting sleepwear to ensure privacy without losing the benefits of ventilation. There are some special considerations. If you are using tampons to treat urinary incontinence, have skin problems in your genital area, or are dealing with a yeast infection or irritant dermatitis, talk to your dermatologist or urologist for guidance. Either way, staying clean, dry, and well ventilated is always helpful, and choosing breathable, friction-reducing materials can help make your skin more comfortable. Healthy lifestyle and weight control. Every decision in your daily lifestyle can help improve or, on the contrary, weaken sexual function. Unfortunately, in modern life, many bad habits silently erode men's health, and only when the damage becomes serious do we suddenly realize it. Everyone knows that smoking is bad for you, but few people realize how much it can affect your sexual performance. Not only does smoking reduce your ability to get an erection, it also increases your risk of bladder cancer, one of the most feared cancers urologists see. Bladder cancer treatment often requires major surgery, including removal of the bladder, and can be life-changing. Studies have shown that men who smoke are twice as likely to suffer from erectile dysfunction as non-smokers. The same goes for alcohol. Drinking too much alcohol can lower testosterone, shrink testicles, and impair erectile function. What's even scarier is that erectile dysfunction isn't just a bedroom problem. It's also an early warning sign of heart disease. One large study found that within 7 years, 14% of men with erectile dysfunction will experience a serious cardiovascular event like a heart attack or stroke. In other words, the health of your penis reflects the health of your heart. Not only cigarettes or alcohol, but also an unhealthy diet is a silent destroyer of male prowess. Eating too much sugar, fast food, fried foods, and saturated fats will clog blood vessels, reduce blood flow to the penis, and cause erectile dysfunction. This is the cause of more than 70% of cases in middle-aged men. The habit of eating a lot of sugar and refined starch also leads to obesity and type 2 diabetes. A report by the American Urological Association found that obese men are twice as likely to have erectile dysfunction as men of normal weight. In addition, the European Heart Institute warns that visceral fat, especially fat around the abdomen, is directly linked to heart disease and type 2 diabetes, two conditions that can seriously affect blood flow to the penis. Not only that, eating too much salt can also increase blood pressure, another cause of erectile dysfunction. Even long-term use of blood pressure medications can decrease sexual desire and affect erectile function. So if you stay healthy, your erections will be good too. That means eating healthy and increasing your intake of green vegetables, fresh fruits, nuts, and whole grains, which are rich in fiber and antioxidants, which help protect your blood vessels. Eat plenty of fatty fish. Fish like salmon, sardines, and mackerel contain omega-3s, which are good for your heart and circulation. Use olive oil, nut butters, avocados instead of animal fats. Avoid smoking or excessive drug use. Try to reduce your alcohol intake and exercise regularly. Aerobic exercise, Kegel exercises, and resistance training are all important for testosterone. So all of these are important and I can't stress them enough. If you don't know where to start, take it one step at a time. Be careful when watching porn. Be careful with porn. Porn is everywhere. A quick search will reveal millions of videos, each more intense than the last. Porn can be fun and exciting, but for many men, it can become a trap. Research is increasingly showing that excessive porn viewing can lead to erectile dysfunction, delayed ejaculation, and most importantly, psychological dependence. Think about it. Porn is all about novelty and extreme situations that rarely reflect real-life intimacy. Over time, your brain can begin to associate arousal only with the stimuli you see on the screen. As a result, when you actually engage in an intimate relationship in real life, your body can't sustain the arousal it craves. This leads to a phenomenon known as porn-induced erectile dysfunction. Healthy Male, an Australian men's health organisation, points out that comparing yourself to porn stars can lead to performance anxiety and feelings of impotence. Constantly switching between videos means you're always chasing new thrills, leading to an increased need for stimulation. So, what's the solution? First, set limits for yourself. Instead of spending hours in front of a screen, treat porn as an occasional treat, not a daily necessity. Second, focus more on real-life intimacy. A hug, a kiss, a genuine sharing of emotions can sometimes be more pleasurable and bonding than any on-screen scene. Also, spending time exercising, meditating, or engaging in activities that naturally release dopamine in the brain will help reduce your dependence on artificial stimulation. And most importantly, if you find yourself having trouble controlling yourself, talk to a urologist or psychologist. It's the first step to reclaiming your sexual freedom and power. Avoid injuries, even minor ones. Many men believe that their penis is healthy and unlikely to be damaged. But the truth is quite the opposite. The penis is one of the most sensitive organs in the body, and even a minor collision can have long-term consequences. What is worrying is that many injuries do not manifest immediately, but silently accumulate over time. And by the time they are discovered, their function has seriously declined. Urologists have seen many cases of rupture of the tunica albuginea, an injury commonly referred to as a penile fracture. This condition often occurs during vigorous sex or when the penis bends suddenly. The result is severe pain, bruising, and even surgery. In addition, seemingly harmless collisions such as cycling with a saddle that is too hard, wearing tight pants while playing sports, or repeatedly bumping into furniture can also cause microvascular damage, affecting the ability to have an erection. A study published in the International Journal of Urology found that men who regularly cycle long distances are at significantly higher risk of erectile dysfunction due to the pressure from the saddle compressing blood vessels and nerves in the groin. This proves that even healthy sports activities have potential risks if not performed properly. If you notice a curve in your penis, a lump, or a painful erection, see your doctor. Early treatment can prevent the condition from getting worse. Don't be embarrassed because your doctor has seen this before. Also, protect your penis when playing sports. Use a menstrual cup when playing contact sports like cycling or soccer. Are you ready to make these changes? Don't wait. If you have any questions or need more guidance on how to improve your diet, leave your answer in the comments below. Let's break the silence together because you are not alone, and your story may help other men who feel the same way. My name is Dr. Laura. For over 25 years, I have dedicated my research and expertise to helping men and women over 60 regain their health and confidence. I am here for you. If this message resonates with you, please share it with others who need to hear it, because we are all aging, but we don't have to do it alone or in silence. If this video helped you understand your body better or made you feel less alone, please take a moment to subscribe to our channel for more science-based discussions about men's health and vitality.